My name is Evan. I am a CNA at Johnson City Medical Center, and I'm going to be talking to y'all a little bit today about the understaffing of nurses in healthcare and the crisis behind it. Specifically nurses, just because they are the front line of healthcare, seeing the patients, rather than doctors, because everyone wants to be a doctor. We don't have that bad of a crisis for doctors rather than nurses. I work firsthand in healthcare as a CNA, so I see the crisis, but I will also be using the Veterans Affairs official website, so Department of Health and Department of Veterans Affairs official website for some of my information today. So pretty much in the United States, there is a big crisis of understaffing of healthcare workers. And you might think, this doesn't really apply to me. I have nothing to do with that field. I don't want to work in that field. But it does apply to you, because everyone has to deal with healthcare. Everyone needs healthcare. So not only does it affect the patients and the employees that work in healthcare, but the family members and friends of those patients that need the amazing healthcare that they deserve and that everyone deserves. But with the crisis, we aren't getting that right now. So why we are having this crisis right now? Pretty much it boils down to underpaid. Nurses are not paid enough for the work that they are having to do. On my floor at Johnson City Medical Center, there is one nurse per 8 patients. And you might think, oh, that's not that bad, but it's critical care. So every patient is constantly needing care from a nurse. And let's say 2 patients need critical care in that moment, the nurse pretty much has to decide who needs it the most right now. Who is my priority? And it shouldn't be like that. It should be a much shorter ratio than one nurse per 8 patients. And then CNA wise, it's not as bad, because we aren't giving the full-on care. We are giving the minimal care stuff, but we are one CNA per about, it can range from 10 to 24 patients on a floor, depending on who all is working. How to fix the understaffing? There are many ways to fix it. You could easily say we could pay nurses more. But it's gotten to the point to where travel nurses are a thing, and they get paid 6 figures. And that is where all of the budget and everything for healthcare is going, is travel nurses now. Because travel nurses can make upwards to $90,000 to $130,000 a year just for traveling to a different state, or even just a few hours away and working at a hospital that needs it, when really the hospital they probably live near needs the help too, but just because they're getting paid probably what they deserve to get paid, they're traveling that far. And so the Department of Veterans Affairs uses staffing methodology. And staffing methodology is, they look at the resources and the population of the city or area, and they decide how much the nurses should get paid, how much nurses they should have staffed, and the government or regulation and law is undermining how much we should actually have. because, like, the ratio, like I was talking about earlier, is completely not okay. It should definitely be at most one nurse per 4 patients. And pretty much to sum up all of this, I just want, if you are watching this, I want you to think how this affects you, and how, like, if you've had an experience to where you feel like you were not getting the care you deserved, and if you felt like there could have been more care given to you. I hope y'all enjoyed, and let me know what you think.